So, dignitaries on dais, off the dais, I'll bring you back from technology to more real-life mundane things. Having said that, we use technology in many of our interventions, but just a disclaimer that I'm talking more on real-life things. So, what we'll talk about, I'll give you a background on tuberculosis because I think we are all talking in silos about single diseases. So, I'm referring to TB because there is a commitment by Government of India to eliminate TB by 2025, which is 5 years ahead of Sustainable Development Goals. And we are trying to support Government of India to reach those goals of elimination of TB. An important component of elimination of TB is workplace interventions. So most transmission either occurs in households or workplaces. So we are talking about workplace interventions, but all of you being occupational health experts, so I'll skip some of the slides which are more introductory in nature. So you know about organized and unorganized workforce and need to address both sections of the society and how any disease for that matter affects your productivity, absenteeism, etc., and what is the cost to the exchequer which any disease causes. And TB also annually causes a loss of about 13,000 crores to the exchequer at the national level. So the context here is that India remains the highest tuberculosis burden country in the world. So unless we eliminate it, the world will not be able to eliminate it. We are 30% of the global burden. And 2030 is what Sustainable Development Goals has articulated to eliminate TB, and 2025 is what Prime Minister of India has articulated there. So there is a huge level of commitment from the highest echelons of the bureaucracy, politicians, etc. So you must have seen many chief ministers, governors, bureaucrats, and even lay public adopting TB patients and offering them support, whatever they can offer in the form of incentives, nutrition, livelihood option, etc. And many of you present in the room are partners with us in this journey of helping the government to achieve this. So we are aligned with Sustainable Development Goals, which is Goal 3 and Goal 8. Goal 8 is relating to the occupational health of the workforce, and Goal 3 is regarding elimination of disease. So it gets clubbed with the other infectious diseases, but this we are aligned with the Sustainable Development Goals. Role of workplaces in TB elimination, I don't have to actually articulate much to this august gathering what role they can play, but I'll give you a few examples on how we are going about these interventions. Of course, the challenges remain in how do we assess those workplaces, how do we actually motivate workforce, how do we motivate corporates to adopt those interventions. But having said that, we started this journey about 4 years ago, and almost 300 corporates are now partners and stakeholders in our journey. Many of you are contributing either financially in cash or in kind or in terms of services. So many houses are contributing to that. So we have seen that workplaces play a vital role in TB elimination. Here are some of the examples where we have worked. Is Best Mumbai. It's also regarded as one of the best employers in terms of they have screened not only their workforce but their extended families also, and they are in the process of saying that Best Mumbai will be a TB free in a year or two. Similarly, the other picture is Paramount Garments, Goodrich Group. So some of our interventions, I'm just taking you through that journey. How did we institutionalize this TB and free workplaces? So we first developed a policy on TB and workplace intervention, which was a combined for HIV and TB way back in 2017 with International Labour Organization. Subsequently, this policy framework was adopted by Ministry of Labour and Employment. They released the same policy in 2019. And Ministry of Health had a memoranda of understanding with Ministry of Labor and Employment in 2019, and now we are at a stage where state governments are actually adopting this policy within their charters. So Jharkhand was the first state to adopt. Himachal Pradesh will be the next state to adopt, but we are engaging with all states at the policy level for helping them support in this adoption of workplace and TB policy. So we have sort of listed out few steps and the concept of TB-free workplaces. Again, in the interest of time, I think most of you understand concept of any disease in workplaces. So it will be, I'll not actually elaborate on many of these things, but having said that, access to information, knowledge about TB, provision of services remain important enablers in this journey toward TB-free workplaces. And again, how do you implement? So we suggest that you have a committee in the workplace, on TB-free workplace committee, have a policy in place. We generally follow the pattern of having master trainers and following the cascade training within the industry. Also, we sort of gave you support with your communication materials and what awareness you can do. We develop specific materials for that. We link you with the TB diagnosis, free treatment through the local agencies in whatever part of the country you are. And also we would like that you include this in the induction, when you induct a new HR into your system. Again, these are some of the workplace interventions, just to get a flavor of it. You see Apollo Tyres, Ambuja Siemens, Goodrich Group, Adani Group, Best Mumbai, where we have actually gone a level ahead and implemented these policies. The basic elements of workplace policy, you see articulated commitment from some of the stakeholders. The one which you see here is from the Goodrich Group. So we tell them to provide a healthy environment, promote early diagnosis and treatment initiation, support employees getting diagnosed with TB and increase treatment adherence, increase awareness among the masses, and also try to say reduce stigma, don't stigmatize. So there are also corporates which have actually incorporated that stigma aspect in their policy. So they are saying if somebody is having TB, we are not going to lay them off. We are going to support them even during their disease, even if they are on a prolonged leave, etc. Some more examples are here. So Larsen and Tubro, amalgamatic plantation, small biodiagnostics. So some more examples where it has been incorporated into the policy. Again, few more examples, Swarovski, L&T, again, various branches. So also the United States Agency for International Development has incorporated it within their policy. We prepare your medical officers, your people on how to go about implementing this. So these are some of the training and communication centers. And as I alluded earlier, follow a policy of cascade training. So some more examples of where we have done these training and communication. Some corporates have advanced to a level where we are actually screening their entire workflows. And some examples of those Apollo Tyres, Goodrich Group, Best Mumbai, where we have actually screened the entire workforce for TB. I mean, they were the main leading the screening. We are just the enablers and a sort of a moral support behind them. So we don't actually send out our people to screen. It's screened either by the local health authorities or by the company themselves or by their employees, and we get pieces together. So we ensure that it's free of cost to the extent possible to the companies or minimal cost to the company. Again, this is a sample checklist on how do we go about TB eliminations. Again, these are indicators which we have developed, how corporates should go about doing that, and we'll leave it for your perusal later on. So some of the indicators which we have developed. And the idea is to align ourselves with the vision of the government, which is 2025, and support them. Many of you are partners in our journey. Those who are not can also join. We also run another program which is called Corporate TB Pledge. So almost 300 corporates have pledged to eliminate TB from their workplaces. And also we have 4 tiers of involvement, which we call them silver, gold, diamond, platinum. So silver is when you just commit to eliminate TB, and the highest level is when you also act as a role model. You get more corporates to join. You put in resources, your own resources also, and your own intervention. So you are also investing money, you are also getting other people on board, and you are then leading by example to be a diamond and a platinum member. So we have close to 50 corporates who have that level where they are investing the resources, they are sort of leading the initiative and taking it forward. These are some of our brand ambassadors. So now the program has engaged Amitabh Bachchan is a brand ambassador. Then we have Rajkumar Rao, Deepa Malik, PV Sindhu. They are now brand ambassador towards TB elimination in the country. And through our support, we have got them pro bono. So they are not charging anything to the program, and they are helping the program to spread that message of TB elimination. Yeah. Thanks you for your attention. And again, those of you who are not committed or not part of the corporate TB pledge, we will urge you to become one, and you may contact us. Our offices in Katwaria Sarai. It's a regional office for Southeast Asia. So my details are available with the organizers. So we'll welcome reaching out to you. Thank you.